Topiramate 25 mg per milliliter oral solution is a medication that is used to prevent and control seizures, also known as epilepsy. It can be taken alone or with other medications. In addition to epilepsy, it is also used to prevent migraine headaches and decrease their frequency. It's important to note that this medication will not treat a migraine headache once it occurs. If you do get a migraine headache, make sure to follow your doctor's directions for treating it, such as taking pain medication and resting in a dark room. Topiramate is classified as an anticonvulsant or antiepileptic drug. The recommended daily dosage and the optimal timing for taking this medication should be determined by your doctor. Before starting to take Topiramate, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take this medication by mouth with or without food, as directed by your doctor, usually twice daily. It's important to measure the dose carefully using a special measuring device/spoon, and not a household spoon. To prevent kidney stones, make sure to drink plenty of liquids while taking this medication, unless your doctor tells you otherwise. The dosage of this medication is based on your medical condition and how you respond to treatment. For children, the dosage is also based on their weight. Your doctor will gradually increase your dose to reduce the risk of side effects. For some conditions, you may start treatment with Topiramate once daily at bedtime and then slowly increase your dose to twice a day. It may take several weeks or months to reach the best dose for you and to get the full benefit from this medication. It's important to take this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Don't stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased. If your condition lasts or gets worse, make sure to inform your doctor. Side effects of Topiramate 25 mg per milliliter oral solution may include tiredness, drowsiness, dizziness, loss of coordination, tingling of the hands/feet, loss of appetite, bad taste in your mouth, diarrhea, and weight loss. Mental problems such as confusion, slowed thinking, trouble concentrating or paying attention, nervousness, memory problems, or speech/language problems may also occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including signs of kidney stones, rapid breathing, fast/slow/irregular heartbeat, bone pain, broken bones, loss of consciousness, unusual bleeding/bruising, depression, suicidal thoughts/attempts, or other mental/mood problems. Rarely, Topiramate may cause a very serious eye problem, generally within 1 month of starting treatment. Get medical help right away if you experience sudden vision changes, eye pain/redness. This medication can rarely cause a serious metabolic problem, high amount of ammonia in the blood. Tell your doctor right away if you experience sudden/unexplained tiredness, vomiting, or mental changes. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before taking this medication, it's important to tell your doctor about any allergies you may have, as well as any medical conditions you have, such as eye problems, kidney or liver issues, mental health concerns, or breathing problems. It's also important to avoid alcohol and marijuana while taking this medication, as they can increase dizziness and drowsiness. Additionally, be cautious about overheating, as this medication may make you sweat less, increasing the risk of heat stroke. If you are planning to have surgery, make sure to inform your doctor about all the medications you are taking. For children, this medication may have side effects such as weakened bones and decreased sweating, so it's important to consult with a doctor for more details. Older adults may also be more sensitive to the side effects, especially dizziness, which can increase the risk of falling. During pregnancy, it's crucial to discuss the risks and benefits of using this medication with your doctor, as it may harm an unborn baby. It's also important to consult with your doctor before breastfeeding, as this medication can pass into breast milk and have undesirable effects on a nursing infant. It's important to be aware of potential drug interactions when taking Topiramate 25 mg per milliliter oral solution. This medication may decrease the effectiveness of hormonal birth control products, so it's essential to discuss reliable birth control methods with your doctor. Additionally, it's important to inform your doctor or pharmacist about any other medications or products that may cause drowsiness, including alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Always check the labels on your medicines and ask your pharmacist about using them safely. If someone has taken too much of this medication and is experiencing serious symptoms like fainting or difficulty breathing, it is important to call for emergency help immediately. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include extreme drowsiness and loss of consciousness. It's important not to share this medication with others. While taking Topiramate 25 mg per milliliter oral solution, it's essential to have regular lab and medical tests, such as eye exams and bicarbonate blood level tests. It's crucial to keep all medical and lab appointments. If you forget to take a dose, take it as soon as you remember. However, if it's within 6 hours of your next dose, then skip the missed one and take the next dose at the usual time. Do not take double the dose to make up for the missed one. If you miss more than one dose, it's best to consult your doctor for guidance. Make sure to store the Topiramate 25 mg per milliliter oral solution in a tightly closed container at room temperature, away from light and moisture. It's important to discard this medication 60 days after opening or after the expiration date, whichever comes first. Remember not to store it in the bathroom, and keep all medications away from children and pets. When you no longer need the medication or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.